What we're looking at now is the appendicular skeleton. Appendicular skeleton is everything associated with movement. So we're talking about the arms, we're talking about the legs, and we're talking about the structures that actually keep those attached to the body. So I'm going to bounce between a couple of different screens. If you go to the virtual website, for instance, you will see is a list of the various bones that you should know on the appendicular skeleton. And I have a link for this in the online labs tab. But again, we have the bones that we want to identify listed in bold. We have substructures off of those bones that are indented and listed in lowercase. Okay, so if we go to another part of the virtual website, we can see images of these bones. And so let's take a look at that. And there you can see various bones. We've got the pelvis, scapula, clavicle, bones of the humerus, hands, foot, so forth, and different things associated with the joints. I'm going to go to this other application that I used previously, and I will go through the different bones and their structures there. I will probably check at the end just to make sure I haven't missed anything and go back to some of those other images. But as I said, the appendicular skeleton consists of bones of the arms, the legs, and structures that support them. So the first bone we're looking at is the clavicle. And it's a little S-shaped bone. It's toward the anterior portion of the body, connects to the sternum, also connects to the scapula in the back. And I wouldn't ask you to be able to identify very much on that, other than that it is this little S-shaped bone. Now, I think we can see this disarticulated. So let's see if we can see this by itself. And there we have it. There's the clavicle. It has two different ends. It has the acromial end. It has the sternal end. But again, we're largely just looking at being able to identify it. And there's really not another bone in the body that looks like that. Now, let's go to the scapula. And the scapula, also, a lot of people think of it as the shoulder blade. It is the thing that is back on the back side of your shoulder. I'll take a look at this individually, just again for an overview. It is the part that the humerus of the arm articulates with. And again, you can see where the clavicle sits there too. Now let's take a look at some specific structures on this. And there's a lot. You don't need to know all of them, but you should be able to find the spine of the scapula. You should be able to identify the acromion from a variety of viewpoints. There is the coracoid process. Located here. Oh, there we go. Well, there's the coracoid process. And if we go here, that's the glenoid fossa of the scapula. So kind of viewed from a variety of angles here. Coracoid process, acromion process, spine. We need to know the scapula as a whole and the glenoid cavity. Now, a little bit about these. Structures on the body exist for a reason. And bony structures, we have usually either for any kind of raised surface is going to be for muscular attachments. And in fact, we have muscles that attach along here. We have what we call infraspinous muscles. We also have toward the end here the deltoid, which attaches to it. And part of the trapezius attaches along the upper part of that spinous process. This little dipped out area, that is the glenoid cavity, and it is where the humerus articulates. And you'll notice that that cavity is really not terribly deep. It's just slightly dipped out, which means that dislocating a shoulder is something that can occur with relative ease, because what we've got holding it in place largely are muscles and a few ligaments. The hip bone also has a pocket, but it is considerably deeper, so it is much harder to dislocate the hip. Now, the coracoid process is part of where our biceps muscle attaches. So let's go back and take a moment and make sure that I've hit on all of the major structures. But essentially, you should be able to identify those that I've listed. I'm not as interested in the medial border or the lateral border, but you should know that this is the lateral end where we have the glenoid fossa, so that is the outside. I want to see what our list says and make sure that I haven't missed anything. Okay, so I've hit everything: acromion, coracoid process, glenoid or glenoid fossa, and the spinous. So now let's take a look at the humerus. And when I think humerus, I think funny bone. And the reason for that, basically there's a structure on the humerus that we have a nerve that passes through. And when you hit that, that's what gives you that sense of the funny bone. So let's take a look here. Again, we're going to go back, and now we want to look at the humerus. Now, the humerus is the upper bone of the arm. And you'll notice when we're working on these parts of the appendicular skeleton that the upper portion of the limb, the proximal portion, is usually a single bone, whereas the distal portion of a limb usually has two bones. I'll explain to you the significance of that in just a few minutes. And this is the humerus. This is your upper arm. And now we go and take a look at some of the structures that are on the humerus. So, the bony markings, we've taken a look at the overview of it. So now let's take a look at some of the markings here. And markings, it's just another word for structures that are on the bone. But right there is the head, and the head is the part that articulates with the scapula. It is covered with high-lying cartilage, which gives it a nice, smooth, evenly moving surface. And the cartilage doesn't have any nerves in it or blood vessels, so it is not bleeding, and it doesn't cause you any pain when you move. Generally, when we talk about arthritic pain, we're looking at a situation where some cartilage has worn away. Now, we've got two structures here. We've got a greater tubercle and we've got a lesser tubercle. And I'm just going to zoom in a little bit on those. Greater tubercle, lesser tubercle. And I really don't need you to know which is greater or lesser. But if we were looking at a bone, I would just want you to be able to identify these as tubercles, these structures here. Now, we also have what we call anatomical neck. And this is portion right here. It's basically at the spot where the osteum of the bone becomes a connective tissue. which bridges to the next bone. Then we have the surgical neck, and if you were to have to do surgery on an arm, you would do a cut here as opposed to here. Now, go to the distal end here. So this structure is the trochlea, and next to it is the capitulum. And we also have the lateral epicondyle and the medial epicondyle. We have a little raised area here. It's actually like a line. It's called the deltoid tuberosity, and that is where the deltoid muscle attaches. We have this area, which is the intertubercular sulcus or intertubercular groove, which isn't on your list, but that is a spot where one of the tendons of the biceps slides through. On the posterior portion, what we're looking at is the olecranon fossa. When I say funny bone, you'll notice there's a little groove here. That's where the ulnar nerve flows, so it's right in this area. And as a result, if you hit your elbow just right, that's where the whole funny bone thing comes from. Let me see if I can zoom in a little bit. There we go. Now we can see them a little bit better. So the olecranon fossa, which actually corresponds to a structure called the olecranon, and then we have the coronoid fossa located on the anterior portion. These actually act as stops to prevent the elbow from overextending or overflexing. Now, let's go back to the next structures of the lower limbs. And in this case, we're talking about the radius and the ulna. Now, when you take a pulse, generally we take the radial pulse. So we're talking about taking a pulse on the thumb side. So this is the radius. This is the ulna. Let's take a look at the ulna first. General overview here. The ulna, some people, I've heard people say it looks like a can opener. Some people say it looks like a monkey wrench. To me, it looks like a snake that's about to strike, but that's its position. And if we want to take a look at its markings, what we're looking at is the trochlear notch. And let's just move in a little bit here. So that area is the trochlear notch. That's the olecranon. That's the coronoid. So those processes kind of lock in on the humerus. Now, go to the far end. There's a little process that sticks out, and I'm going to look at that from on a different view.
We've just about reached the time limit that you can have on a YouTube video, so we're going to pick up on this in our next video.